Hi, and welcome to Children's National. This video is meant to be an overview of our training program. You'll hear from Mark DiSabella, who's the program director, me, the associate program director, Jeff Strelzik, and you've already been in contact with Rachel Beal, our program coordinator.
So the objectives over the next hour are to explain the curriculum for child neurology at Children's National, to demonstrate the strengths of the child neurology program here, provide you insights into the culture of Children's National as much as we can virtually, and in the end, to try and create a successful match list to pair the right residents with our program. Your goals may include watching how we round, what our conferences are like, and interactions between our fellows and faculty. I want you to question the faculty and fellows about what matters to you most, understand the expectations for training here, and finally decide if Children's National and Washington, D.C. fit your goals the best. The child neurology mission at Children's National is to prepare child neurology trainees for a professional career with ABPN board certification in child neurology, to prepare the next generation of pediatric neurologists to make contributions at the highest level in clinical and academic child neurology, and finally to provide you with the knowledge and skills in order to accomplish those goals. In order to achieve those goals, we understand that adults learn best through their engagement in their education and the decisions that surround them. So every month we have a fellow meeting, and at that fellow meeting we ask our fellows what they need, what's happening on the ground, and then as a program director and our leadership team, we provide what is needed in order to achieve those goals. This is experiential learning, and this happens every day with our fellows. They're on the wards seeing patients. They have this very large and diverse patient population, and their responsibility for those patients allows for them to grow throughout our training program. Our fellows are actively engaged in that program development throughout their entire training, and they drive our curriculum changes, our quality improvement, our educational decisions, and our mentorship. The program itself is designed to be adaptable and fluid, and so what I tell you about today may not look exactly like what you do when you are here, because we need to change all the time to meet the needs of our trainees, our patients, the hospitals, and those changes need to be assessed and proven that they're meaningful to as many of the stakeholders as possible. So our job as the program leadership, myself and Dr. Strelzik, are to provide the resources you need to achieve your goals, to support you in your educational and professional needs, and provide you with the leadership and guidance you need to obtain your career goals. The path from becoming a pediatrician to a neurologist involves your first 2 years at Children's National in the pediatrics residency, your third year predominantly in the adult institutions at Georgetown, GW, the VA, and Washington Hospital Center, all which are within a few miles of Children's National, and finally back at Children's National for your final 2 years. So Children's National Neurology sees about 25,000 patients per year. We have 313 inpatient beds at the hospital, of which 25 are dedicated neurology beds. 15 of them are hardwired for EEG, and we have another 40 or so mobile units. We have 44 neurology providers, including our nurse practitioners, physician's assistants, and all of our physicians. There's 45 PICU beds, 72 NICU beds, and we have 4 positions per year. As you'll notice, we only have 3 in the match because we do 3 categorical per year, and then we backfill positions with reserved. We've actually had an excellent experience with this, and have found that over the years we've had residents already in their pediatric residency that are interested in doing child neurology but wanted to complete all 3 years of pediatrics or didn't recognize this interest till later. We do technically list an advanced position in the match as well, and if anyone is specifically interested, please contact myself or Dr. Strelzik directly, and we can discuss opportunities for that. So this is an overview of the child neurology curriculum. Currently, our PGY3s spend 11 blocks in adult neurology. 6 of those are inpatient, 3 are outpatient, and 2 are elective. They come back to Children's for 2 blocks during that year, 1 on the ward and ICU service, in addition to having a week of vacation, and the second block doing the ward service for 2 weeks, running the service themselves, and the second 2 weeks on night float. The system was actually designed during the COVID pandemic and actually ended up being an excellent system in terms of getting our PGY3s ready to run the service all the time in their PGY4 year, in addition to providing them with the experiences they needed in order to be safe and to understand how to provide care to all of those patients. In your PGY4 year, you'll spend 10 blocks on the children's inpatient service, of which you'll have 2 to 3 on the ward, PICU, NICU, and consult service, and 2 blocks on night float. You'll have 3 additional blocks of electives, 2 of those will be electives of your choice, which could include neuroradiology, EEG, research, outpatient clinics, and at least one of those blocks will be in the outpatient rotation. Finally, in your PGY5 or senior year, you'll have 6 to 7 blocks of children's outpatient and research time, so the majority of those are electives. The ABPN and ACGME require everyone do 1 month of child psychiatry, which is split here between the inpatient and outpatient units, and you'll have 2 additional blocks of dedicated child neurology outpatient clinics. All of the outpatient clinics allow for you to see patients both in a general situation, in addition to seeing subspecialty clinics. So you can go to the muscular dystrophy clinic for an afternoon, or come to the brain tumor clinic, or come into headache clinic, but those are up to you. Additionally, in your PGY5 year, you'll have 4 to 5 blocks of the children's inpatient service, where basically you'll spend a block on each of the inpatient services, ward, PICU, NICU, or consults. You'll have 1 block of night float and a half block where you do night float backup with one of the PGY3s. So when those PGY3s are on night float, they're actually paired up with a PGY5 who's at home, who's providing you backup or phone call contact for any questions you have, especially about systems issues, in addition, of course, to your attending. And then finally, you'll have 2 blocks of adult elective, which were left over from that first year to round out the entire 13 blocks for each year. So I like to show this so that people can see what everybody is actually doing. As I mentioned already, we added night float in 2020 during the COVID pandemic and found out that it was a big improvement for our fellows. They felt that patient safety was better, the hands-on learning is better, and their quality of life is better. In order to make this tolerable, we obtained a private call room, so it's not shared with anybody else. You have your own bathroom and shower. We recently put in a large desk. It has a nice computer in it. It has 2 beds that are pushed together to make it king-sized. And then we bought a fridge, a microwave, and a mattress topper to make it all feel comfortable and homey. It's actually right between our neurology offices and the neurology floors, so it's easy if you do have to get over to the floors. In terms of what you need to see in person overnight, it's the same as when we took home call, which is just stroke, spinal cord, and neuromuscular emergencies, but you're not required to go to the emergency department for any other admissions. You're of course welcome to go see things that you think might be interesting or you can learn from, but again, we don't want to be in a slippery slope where we're asked to see every patient overnight. The shift is from 5 p.m. until 6 a.m. Sunday through Friday, and you're off Saturday at 6 a.m. until Sunday at 5 p.m., and people do 2 weeks of that in a row. So we technically have 13 blocks that are actually split into 2-week blocks, making it a total of 26 over the year. And you can see in these 2-week blocks, you do 1 block as a 3, 4 as a 4, and 2 blocks and 1 as backup as a PGY5. These next few slides are just to be completely transparent about what the curriculum looks like. The ACGME requires that we submit a block schedule each year, which shows exactly what you will be doing in each year of your training. They're not in this order, so you would never do adult neurology wards for 8 consecutive blocks. But again, this shows you what the actual program looks like for year 1, year 2, and year 3. And on the bottom of each of these shows what the electives are that you're welcome to pursue. However, of course, we're very open to individuals pursuing any electives that they need for their education. So everyone will be interviewing with pediatrics on the day opposite of this interview, but obviously you'll spend 2 of your 5 years with them. Our pediatric residency is just outstanding. It's a world-class training institution. Their pediatric residency is really, really second to none. The leadership, led now by Dr. Aisha Barber, I just can't say enough about how excellent she is and how much she cares about residents and their education. The residency itself is unionized. We're one of the first to do that, so the pay is competitive, the vacation is very controlled. There are retreats that you'll go on throughout the time here as well. Our patient population is really one of the biggest advantages of Children's National, and because of the diversity of our patient population, it'll allow for you to be board eligible in just 2 years. Not all residencies can necessarily state that, however, we're very confident we can. You'll do 1 month of neurology during every year of your training. So you'll be an intern on the child neurology service. You'll then be a senior when you're a PGY2 on it. You'll come back as a PGY3, as we mentioned, 2 times, and then you'll be on it as a 4 and a 5. So the ACGME says you should have progressive responsibility over your 5 years, and we take that very seriously and definitely provide that here. Finally, starting in your half day, you'll have in your second year, you'll have an additional half day per week for REACH, which is the Research, Education, Advocacy, and Child Healthcare Program. And this will allow for you to work with either your mentor in child neurology or somebody outside of child neurology on a research or advocacy program or a project that you'd like to complete before the end of your training. The next slide shows our adult neurology training, which again is essentially 10 months in your PGY3 year and about 2 months in your PGY5. So you can see the various hospitals and number of blocks you spend at each. So you'll spend about 2 to 4 blocks at Georgetown MedStar Inpatient, which is a 590-bed hospital with 20 staff neurologists, 21 adult neurology residents, and there you rotate between epilepsy, stroke, and the ward service. At Washington Hospital Center, which is actually adjacent to Children's National right out my window, is a 900-bed hospital where you'll be on consults or epilepsy service. In your Georgetown outpatient blocks, you can rotate through various clinics, including movement, epilepsy. They have a great program in neuroinflammation and multiple sclerosis. They have a great headache program as well, neuromuscular, and even the NIH stroke service, where you could see patients that are at the NIH for clinical trials who may happen to have a stroke while they're there, and so you would be part of that stroke team. It's just fascinating. At GW, you'll have 2 blocks on their inpatient service, where they have 371 beds with 20 faculty, and they're now up to 12 adult neurology residents, and there you rotate between the stroke and epilepsy service. At GW Outpatient, where you'll be either in the stroke, epilepsy, headache, or neuromuscular service, amongst others. You'll be at the VA hospital for 1 to 2 blocks, which is predominantly outpatient or stroke. You'll have 1 to 2 blocks of adult elective again that you do in your final year. And then throughout the entire time, you'll be in your half-day continuity clinic here at Children's National, including your PGY 3, 4, and 5 years. The call structure, you actually only take call 9 blocks of the PGY 3 year, and the remainder of the time you'll be taking call at Children's National, which we've already explained is a night float system, or on weekends in your PGY 3 year, you may round on the weekends here. All other call is at Children's throughout the entire training again. So the PGY 4 year is really the bulk of your inpatient clinical child neurology training. And I always say that by the end of this year, I think any child neurology trainee at Children's National could leave our program, pass the boards, and be a very successful attending anywhere. It's because of the various services we have, the patients that we see here, and then the dedication of attendings to each of those services. So we're one of the first services or hospitals in the country to have a designated neurocritical care service, and that was created well over 15 years now by Dr. Steve Weinstein. We've since adapted that model to all of our inpatient services. So now we have a ward service, a PICU service, a NICU service, a consult service, and our night float services. So we have 5 inpatient services. And we'll walk through what each of those looks like in a few slides. So you'll do 10 blocks of inpatient in that year. You'll have 3 blocks of, again, outpatient and electives, and finally your continuity clinic. In terms of the various services, so again, we have 5 inpatient services. So on the ward service, you'll have a dedicated neurohospitalist attending. You're the fellow on that service. You'll have a PEDS senior, which will be a PGY3 PEDS resident, unless they're doing neurology, in which case it's a PGY2. You'll have 2 interns in the day, 1 at night and 1 that's in the outpatient world. And then we have an amazing nurse practitioner that's been running our ward service for years, Ann Vasiliadis. She helps us with everything from authorizations to communicating with parents and patients to orienting you to the service to just providing you with day-to-day support on anything you need. The consult service has your neurohospitalist attending, a neurology fellow, and then all the adult neurology fellows or residents from any of the Washington, D.C. programs rotate here. So all the GW, Georgetown, and Howard residents are going to be here, in addition to some from the Walter Reed Medical Center. When you're in our PICU and CICU service, you'll have your neurocritical care attending. You're the fellow. We have 2 nurse practitioners in the neurocritical care unit, and then the entire PICU team. So your PICU attending and fellows and residents. NICU, you have your neonatal neurology attending, you're the fellow, and the entire NICU team, just like the PICU team, with an attending fellow and residents. So night float, here you'll be using the attending from the various services based on what the question is overnight, and you're the fellow for that. And then finally, in the outpatient service, which we just designed this year, you're obviously the fellow working one-on-one with an attending. So the way that is organized is that you'll be rotating here at Children's National. You'll have 2 dedicated clinics per week in addition to 3 other clinics that you get to choose from where you'll have your own schedule. So 5 half days where you'll have your own schedule to see patients and staff with an attending. In addition to that, the other 5 half days of the week you can use to see patients in any subspecialty clinic. They may not be able to schedule a patient for you because most of these are going to be multidisciplinary, like the muscular dystrophy clinic, which has a variety of attendings at it, and these patients are scheduled out well in advance. But you still go see those patients, staff them with the entire neuromuscular team, and that provides you with a really broad experience so that you can get a better understanding of those complex conditions. In your PGY5 year, you'll really focus in on elective time, more time in the outpatient clinics, time doing research, and really getting all the qualifications for the board exams. So as we discussed earlier, you'll have about 6 to 7 blocks in outpatient and research. Of those, about 4 definitely electives. You'll have 1 of psychiatry as mandated by ACGME and 2 blocks in the outpatient clinic. You'll have 4 to 5 blocks in inpatient clinical child neurology, so 3 total on the ward, PICU, NICU, or as the consult senior, and then 1 on the night float, which also then includes that half a block of backup to your PGY3s. You'll have 2 blocks of adult neurology elective because you're mandated to do 12 total months of adult neurology and you only did 10 in the first year, and then of course still your continuity clinic. I always like to point out on this slide, a lot of famous people come to Washington, D.C. throughout the year. So every year the First Lady reads a Christmas story in the lobby to the kids that are admitted at the hospital, and they zoom that into their rooms now. In the pictures here, you can see Justin Bieber on the top. Conan O'Brien used to visit every year. The Queen and Barbara Bush are also in that bottom slide. So for our monthly education schedule, there's really a multitude of opportunities that are happening throughout the year. So on Mondays and Tuesdays, one of our seniors, who's the designated chief for that month, will provide lectures to the pediatric neurology ward team. So the peds residents on the service are going to get a lecture from you from 8:30 to 9 every Monday and Tuesday. Your attending will do that lecture on Fridays, but this gives you a chance to teach our peds residents and medical students from GW and outside institutions. On Mondays, we have quality improvement and safety rounds we call critical events review. And there we discuss anybody that bounces in or out of the units, patients that go into status epilepticus, or any adverse outcomes, and try and look for systems issues that we can make improvements on. And this happens once or twice a month. Every Tuesday, Thursday, and Friday, we have noon lectures for our fellows, and that includes a potpourri of lectures. So everybody that's related to neurology lectures in there. So you'll have our neurologists talk about their subspecialty interests. So I'll do a lecture on headaches and fellowships and jobs. We will have our psychiatrists come in and talk about psychiatric principles and pharmacology. We'll have our neuroradiologists come into this and provide lectures on neuroradiology. Our physical medicine doctors, our neurosurgeons. So everybody is involved in this. Additionally, you'll have more than 15 board review sessions between myself and some of the other faculty over the year. You have monthly neuroangiography with our neurointerventionalist here, Dr. Monica Pearl. You'll have fetal neurology conferences run by our Department of Fetal Neurology, including Dr. Schlotterer and Dr. Duplessis. And so I think this really has provided an excellent breadth of educational opportunities for our fellows to learn. We have more than a 95% board pass rate as well on that first attempt. Additionally, the second Thursday of every month is our education day, where we have formal intake, which means that our fellows provide a more formalized lecture about cases they've seen. We have a clinical neuroscience lecture, journal club, and M&M. I also just wanted to point out the intake lecture. So everybody at these interviews will be invited to come, but every Thursday at 1 o'clock, except for that second week on Education Day, we do intake. This is an informal presentation with either the ward, NICU, or PICU service, where the resident or fellow from that service will present an interesting case that's going on. And after they do a one-liner to get us started, we create a differential diagnosis. We then get a full HPI and past medical history. We go through vital signs, an examination. Then we have one fellow basically summarize the case into a single line. They localize the lesion, and then we go back to our differential, cut things out that seem unlikely, add things in that we don't think were there, and then we start to request tests. And then they show us the tests as they happen. And we try and work as a team to get to the diagnosis and really develop our critical thinking and localization skills in child neurology. This is our favorite conference of the week. all of our faculty come to it. It's actually been amazing since Zoom. The attendance is almost perfect for it. And I hope you really take the opportunity to come and join us at some of these throughout the interview season this year. At the main campus of Children's Hospital in Washington, D.C., we have numerous subspecialty outpatient clinics. All of these, for the most part, are multidisciplinary, and you can see a list of them here, which is quite extensive. I could just explain the headache one, as that's the one that I participate in, which has a neurologist that specializes in headache, in addition to having a pain-focused cognitive behavioral therapist, which is a psychologist, Dr. Fletcher, who runs that with us. Additionally, we have even broader multidisciplinary headache clinics that include physical medicine and rehabilitation, pain medicine, neurosurgery, and nursing as well.
Every Thursday, we have a meeting with our fellows. The associate program director, and all the fellows come together and talk about what's going on in the program. And the fellows suggest ways that their education or wellness might be improved with changes that could be made to the program. And we take those suggestions and use QI methodology to try to achieve those goals. And you can see that there are a few different things that we've done to that end. A few of those are added a doc of the day, a telehealth nurse, a prescription call service, to take away some of those calls from the fellows that they're getting that really aren't very educational and take up more of their time. We've also added an outpatient infusion center so that the patients who are coming in just for an infusion don't have to have an H&P and a discharge summary, which may not be as educational as some of the other patients that they're seeing on the ward service. We also have added an independent consult service attending so that the wards attending can focus on the wards, the consult attending can focus on the consults, and they can educate each of those teams independently and really put their whole focus to improve both the educational experience and the patient care that we see on those services. And then lastly, we have started a new initiative that we're calling our social groups, where we take a PGY 1, 2, 3, 4, and 5 from each year. We pair them up with volunteer attendings and advanced practice providers who wanted to be a part of this initiative so that they can go out and have fun and everybody can get together and be a part of our group. We want to make sure that from day one, everybody feels like they know the people, they're a part of our program, and they're not in a completely separate program, either in their pediatric years or in their adult year. So far, it's been going really well. Our formal mentorship program is something that starts during the first year of your residency. And our goal is to provide you with a professional mentor and a research mentor who sort of align with your goals. So you'll see that there's different tracks that you can be on, and depending on what your interest is at the beginning, we'll match you up with someone. And that can change over time if your interests seem to change, but we think it's really important to have somebody available to you as soon as you start residency that can give you some longitudinal help. So you're paired in your PGY 1 year, you're meeting with mentors quarterly all throughout your training program. And the goals really are to make sure that they're helping you advance in your career and personally and professionally in the ways that you want to be. Hopefully developing a long-term plan for how you're going to achieve your career goals or your research goals. And then finally, giving you that focused research mentoring so that for someone who may not have the experience or the background to carry out research on their own without a mentor, that's there for you as a resource. You'll see that a lot of our former residents have accomplished a lot with over 10 CNS Junior Investigator Awards and over 100 abstracts and posters in the last 8 years. The last thing I want to mention about this slide is that I did not create it. It would be kind of weird for me to make a slide with a picture of just myself and one other person on it. I think this is Dr. DiSabella's way of showing you what I used to look like when I had hair and I wore long ties. I don't want you to think that this is something that I did for myself. I like to include this slide just to show off our current residents. We have 4 in each year. You'll see that in the class of 2027, that there is an extra spot that's not filled yet that will fill as one of those advanced or reserved positions. Every other year has 4, and so you can see our PGY 1s through our PGY 5s.
This is just a photo of all of the fellows that ended up here as child neurology attendings just over the last, this is probably 15 years right now. And in fact, the majority of them come since I've been program director, which has only been about 10 years. So starting right here with Dr. Wells, second from the right in the top row, all of these have been since I've been here. So we're very proud to have trained all these individuals, and even happier that they chose to stay here with us. I think it really shows that it's a great program because people have chosen to stick around with us. We're also mindful of the fact that we don't want to be entirely filled by internal candidates, and so we've made it a very active goal to recruit from outside as well. And in fact, we have a really nice balanced staff for that reason.
Each year, we ask our graduating fellows to make slides with some of their accomplishments from their residency. And I'm going to go through a few of those with you now. The first one is Heather Kaminsky. She's right now employed in Rochester, New York as an attending focusing on headache and developmental disabilities. She wanted to mention that she completed the LEND Fellowship, which is for learning and education in neurodevelopmental disorders. And she did that in her final year of residency. She also highlighted that she was the social media creator or the social media manager for our residency program Instagram account. Nikki attended the Pellick Seminar in Boston in 2021. She also had a few projects that you can see here, one of which was a poster about near complete recovery of a patient with Bayless ascariasis, which is raccoon roundworm infection of the CNS that had a near complete recovery, which is a really interesting case. She's now in Ann Arbor at Michigan as a neurohospitalist. Justine went on to be an epilepsy fellow at the Children's Hospital of Philadelphia. She, after that, plans to do a sleep fellowship. During his training with us, Kuntal had 23 publications in peer-reviewed journals. He also co-founded a new program for teaching neurogenetics that combined both our program and the program from University of Michigan to have a joint case series where we discussed neurogenetics cases that were really interesting. He's now a neurogenetics faculty here with us still at Children's. Vika completed the Penry Epilepsy Mini Fellowship, and during her time as a resident, she also did some retrospective chart reviews, one of which was about pediatric vasospasm. Right now, she is an epilepsy fellow at GW.
Children's National has a very long-standing history of diversity and inclusiveness. Washington, D.C. is one of the most diverse cities in the United States, and this plays an integral part in our program. This hospital was created under the tenets of diversity and inclusiveness. Over 150 years ago, Children's National was built and was designed to be in the middle of a city with a lot of diversity and a lot of people that did not have access to care. And Children's National was a free hospital, and we continue to provide free care to any patient that comes to our doors. So in addition to doing that for our patient populations, we feel really passionately about that amongst our recruitment and our staff as well. And we really strive to be an inclusive environment in every way possible. Diversity, equity, and inclusion have been part of our three pillars of the institutional strategic plan way before it was trendy. And we have a diversity committee in addition to all of this that was created in response to all the national tragedies that happened over the last couple of years, and now has really molded our path and in fact resulted in even more dedication to those areas within our division and our hospital in general. Children's National has been ranked number 3 in neurology and child neurology and neurosurgery for the last 2 years. We've been in the top 10 since before 2015. I think it's great to see that we are in these rankings, and I think that only shows how dedicated we are to our patients and our research and improving their care. You can see we have over 100 research and clinical trials that are IRB approved here, and I think that really, again, just shows the depth of what we have.
I think it helps to have an understanding of the structure of our department. Dr. Packer is the Senior Vice President of Neurosciences. Dr. Wells is our Vice President of Neurosciences and the Inpatient Director, and Dr. Guyard is our Chief. Underneath the Chief are our 4 directors, so Dr. Wells is the Inpatient Director, Dr. DeFazio is the Outpatient Director, Dr. Sansevier is our Research and Mentorship Director, and then Dr. DiSabella is our Education Director.
So as I mentioned, Dr. Packer is the Senior Vice President of the Center for Neurosciences and Behavioral Medicine. He's the Director of the Brain Tumor Institute, the Neurofibromatosis Institute, and the PI on all of these impressive studies below it. I think it's really unique to have a vice president like him because he is intimately involved in our decisions. So I mentioned fellow meeting earlier. So this happens once a month on the first Thursday of each month at noon. The first half hour of that is Dr. Strelzik and I talking with the fellows about what's going on the floors and what their needs are. And this is, again, how we make curricular changes and any changes to the department or our training program. The second half of this meeting, Dr. Wells, Gaillard, and Packer come in, and this is where we get institutional buy-in. And this is how we make these big changes, and this is where it comes from. So years ago, when we needed a night float system and we needed more funding for all of these things, this is what Dr. Packer buys in on. So he's really dedicated to that. He truly cares about our fellows. He meets with them one-on-one, and he's just a great person to be on your side. He also happens to know every child neurologist in the world. And when you're ready for your job, whether it's here or outside, he is the guy that can open doors for you anywhere. As I mentioned, Dr. Wells was promoted to the vice president for the Center of Neurosciences and Behavioral Medicine this year, and it was very, very well deserved. I had the honor of briefly serving as her program director in her final year or two of training. However, I knew that she was going to pass me very quickly. So she's the director of our inpatient neurology service. She runs our neuroimmunology program. And she also is really one of the leading individuals in the neurohospitalist movement across the entire country. She's PI on a lot of things. She's medical staff president as well, and you can just see all of her accomplishments. But on top of it all, Beth is a genuinely delightful person who cares about you and brings out the best in everybody she works with. And I think you'll really appreciate working with her and her mentorship that she provides to all of our fellows here. Dr. Gaillard is the quintessential child neurologist and an outstanding chief. I couldn't have asked for somebody better to lead our department here. He is an affable and delightful guy who also happens to be exceptionally accomplished in the world of epilepsy and child neurology. So he has more than 200 publications and 50 chapters based on epilepsy and epilepsy imaging. He is the president of the American Epilepsy Society, the prior chair of the International League Against Epilepsy, and he is the award winner for the Clinical Research Mentor as well. The next slides just show us all of the different teams that we have in the hospital. If somebody has a star, that means they trained here and stayed here as well. So here you can see all of the ward and consult neurohospitalists. The next slide shows our neonatal neurocritical care team.
The neurocritical care team has 6 different attendings who see patients in the PICU and CICU throughout the year. On the top row, you see Dr. Hera, Dr. Sansevere, and Dr. Pergami, and on the bottom row is Dr. Wells, Dr. Mabwana, and myself. There's 2 NPs on the PICU and CICU service, Katie Staso and Caroline Conley. They're so helpful for our fellows, especially as they're adjusting to the PICU for the very first time. They just really know what they're doing and are so helpful. They're also great for continuity because we have different attendings who are rotating through, different fellows who are rotating through, and so they're a constant presence there in the PICU, especially for those kids who sort of have a longer course. They can help remember what happened when they first came in, what was happening through the middle of their course, and so having them on our service has really been great.
Our epilepsy team, which is one of the largest in the entire country, which, as you can see, does about 40 epilepsy surgeries per year with quite a few more evaluations. Pediatric Specialists of Virginia, which is our Northern Virginia subsidiary. So this is a group of people that are both faculty at Children's National and also Inova Fairfax, which is a large community hospital in Northern Virginia. And you have rotations for outpatient that you can go there as well. Our pediatric neurosurgeons, of which we've just recruited 2 additional for a total of 5 right now.
These are our neuroradiologists, Dr. Kadamian, Dr. Murnick, Dr. Pearl, Dr. Schroeder, and Dr. Vizina. And we're going to have one other neuroradiologist who's joining us soon. This is a great group of people to work with. Dr. Pearl is our neurointerventional radiologist, so she does all of our thrombectomies, and she is very easy to work with and always available to teach. On the 4th Monday of every month, she does Neuroangiography 101, which is a really great educational opportunity that she actually came up with and proposed, and we love that she does it for us. Children's National also has a number of fellowship opportunities. So we have an ACGME approved epilepsy fellowship with Dr. Anwar, who's the director, and that's a 1-year program. A prenatal neurology fellowship with Dr. Penn, which is a 2-year program. A fetology fellowship with Dr. Duplessis, which is a 1 to 2-year program. And then we have a neuro-oncology fellowship with Dr. Packer, also a 1 to 2-year program.
In terms of research at Children's National, we've always been very strong in this, but I have to say right now is one of the best times to come to Children's National based on some changes in the last few years. So Dr. Gallo and Teach run the Children's Research and Residency Program, which is a dedicated program to getting you involved in research throughout. Children's National Research Institute has been the 7th in NIH funding amongst all freestanding children's hospital and has a very large research budget each year.
In terms of research support, you have mentorship from Dr. Guyard, Dr. Grootman, and Dr. Sansevier, and then additional support through the sources listed below. So there's a semi-annual research update and neurology grand rounds presentations that you can present at. You have the opportunity for departmental support for your research expenses. And then there's a mentorship committee for submissions of fellowship applications, so things like K Awards and others.
There's monthly meetings for K and R grant preparation. We have internal vouchers, which are $10,000 to $25,000 and actually very achievable. And we've had a variety of fellows get these to start kind of grassroots research projects. There's a Board of Visitors grant, which also is a smaller grant and also very achievable for our trainees here. You can see in terms of our clinical research programs, we have very mature programs in epilepsy and neonatal neurology. We have developing and very strong programs in neurocritical care and headache and white matter, global neurology, neuromuscular, immuno, hospitalist, and concussion. And then some of the other programs listed here as well in terms of how we're developing our research projects and programs. The Master Teacher Leadership Training Program is another excellent opportunity for our fellows after they graduate if they stay as faculty at Children's National. Children's National has really been thoughtful and insightful in asking that all program directors complete this program in order to obtain a master's in education. I completed this in the past, Dr. Strelzik is completing it right now, but this is 18 credit hours over a year where you have classwork in education, including how adults learn, which is adult learning theory, curriculum design, how to assess learners, how to assess programs, qualitative research, how to work on teams, and organizational leadership. I have to say, it really impacted my ability as an effective teacher and leader. This is a great opportunity, again, for our faculty as soon as they finish fellowship, or for those that join us from outside that are interested in education. We've had the honor of working with 2 faculty here, Dr. Doug Postles and Dr. Tesfaye Zaleka, who run rotations in Africa, in addition to Dr. Tafazio, who has also worked in Africa as well. At this time, all of our pediatric residents, both internal and external, in addition to our child neurology fellows, are welcome to go do a supervised pediatric neurology rotation in Africa. There's a travel grant which pays for the cost for this, and you live in Africa for about 1 month and provide care to children in a hospital there as the child neurology service. Additionally, Dr. Postles and Zaleka have a variety of research projects which you can get involved in, and in 1 month, they will provide you with enough data and experience to make your own abstract or publication out of this. Their focus is on cerebral malaria and using EEG to try and predict outcomes in that. But this is just an excellent opportunity that we hope our fellows that come here take advantage of. If you are interested in global health or advocacy, this is really paramount to our program. Children's created a variety of camps called Brainy Camps over 25 years ago, and they continue to grow each year. We now have our own dedicated camp the hospital owns, and there's camps throughout the entire summer for epilepsy, cerebral palsy, Tourette's, autism, Downs, neurofibromatosis, and hydrocephalus. When you go, you're the camp doctor. It's actually a lot of fun, but a lot of work. You get to divvy out kids' meds. You get to watch them when they're in the pool, although there is a lifeguard. When they have cuts and bruises, you help with that. But it's actually really humbling as an experience because you get to see what the children's parents do day in and day out. You'll do it for a couple days while you're there, but those parents are giving their kids meds in the epilepsy camp, for example, 3 times a day, maybe 2 to 3 drugs. They're also the same parents that are sitting at the side of the pool when their kid with epilepsy who has recurrent status epilepticus is in the deep end. And you get to kind of feel that as a doctor and as a human. And I think it's really important for our education and also to be empathetic to our patients. Enough about the program. Let's talk about DC. So when I was in my interviews, I remember an attending that I was interviewing saying, you're going to make what you're going to make of your residency. You're going to go to the hospital. You're going to work as hard as you're going to work. You're going to see your patients, and you're going to learn what you want to learn. So the most important part is being in a city that you want to live in. And I have to say that's played a really big part in how I made decisions to come to Children's National with my family, and DC is outstanding. It's a great place to live. And so the next slides are really dedicated to that. So you can see here on the DC Life, we have on the top left a slide of the inaugurations that occur here. Top right is Adams Morgan, which is was a really cool neighborhood when I moved here 15 years ago, then became not so cool, and now is super hip again. Bottom left is the 930 Club, which is a tiny club that has great shows. I saw Paul Simon there. I saw Trey Anastasio from Phish there. I saw My Morning Jacket there. They've now opened a larger venue called the Anthem, which is still very intimate and has great acts come through all the time. If you are more cultured than me, then the Symphony, of course, is on the bottom right. Moving on to the next slide, here you can see in the top left some of the Smithsonian's. Moving over to the right is the various circles throughout Washington, D.C. Our city is designed on this grid created by Pierre L'Enfant, which includes diagonals that go into circles, which people hang out in, and also makes traffic a little difficult sometimes, but sometimes easier. Moving one to the right is, of course, we have pretty amazing fireworks in the nation's capital. Moving one to the left from that is, of course, the National Monument and people on segways. Moving over one from that is the DC Navy Yard, which was voted one of the coolest neighborhoods in Washington, D.C., and where I happen to live. Moving down to bottom left is Chinatown, which is a very awesome area here. Moving to the right of that is our cherry blossoms, and finally to the Kennedy Center, which now has been completely redone and has a big outdoor venue for live concerts. I recently saw one of the original lead guitarists from Bob Marley and the Wailers play a free concert on a Sunday afternoon for children. So DC really has a very nice community feel to it, and it has to do with our neighborhoods. So each of us have our own neighborhoods that have their own feel, and people really kind of stick to their neighborhoods or bounce between a few of them. We also have an amazing public transportation system, our metro, which you can see an older map of here. There's actually a couple new lines on that since the time it was done. If you happen to be a foodie, DC is the place for you. DC is notorious for excellent food. It has to do with our multicultural environment here. So the largest Ethiopian population outside of Ethiopia is here. We are huge brunchers, as you can see on the top right there. Awesome seafood all over the place. Ben's Chili Bowl in the middle is a foundation of Washington, D.C., has an excellent half smoke is the name of their hot dog, but it's kind of like a hot dog kielbasi combo with really excellent chili sauce, onions, and mustard is the standard way. So if you're not a vegetarian, when you make your way to DC, make sure to stop and get a Ben's. It's the first thing the Obamas did when they moved here. You can see on the bottom left the list of all the different Michelin-starred restaurants, of which we have quite a few. I would just like to point out that Rose's Luxury on there was the #1 restaurant in the United States just a few years back, and you could eat there for under $50. Forbes has ranked us in the coolest cities in the United States, top 5 since 2014. We have, again, a huge amount of diversity, a lot of arts and culture. Recreationally, DC is a very green city, lots of places to walk around, drive around, or bike around. There are bike lanes everywhere, and you can bicycle or electric scooter throughout this whole city. If you like sports, DC has all of the major sports represented, from the Nats, who won the World Series just back in 2019, to the Caps, who won the Cup not too long ago, to the now known as Washington football team, who has not won anything in a very long time. We have a great soccer team, the DC United, who now has a new stadium right by the baseball stadium that's amazing. We have the Wizards. We have DC Washington Mystics, who also won the title, I believe, in 2019. And then not too far away is Baltimore with the Ravens and the Orioles. If you come to us in Washington, D.C., you also get to come to all of our museums for free. thank you for your donations via your federal taxes your entire life. But all the Smithsonian museums are free, so you can go to the zoo for free or go to any museum and not feel like you have to spend too much or too little time, because they are free for you to walk around, and most of them are open 364 days per year. If you happen to have children or plan to in the future, the DC, Maryland, Virginia, or DMV as we call it, schools are outstanding. They have been some of the top ranked schools in the entire country for a very long time, but Northern Virginia and Maryland have some of the top rated schools, and DC public schools now are really on the rise. My kids go to DCPS and we think it's outstanding. They've been going there for more than 5 years. They can walk to school just a few blocks from our house. In terms of day trips from DC, so DC is really nice and centrally located. You can get out to Baltimore is only about 45 minutes north, as long as you don't go during traffic, in which case it's about 4 hours. Philadelphia, via a new expressway on the Eastern Shore, you can get to in nearly 2 hours as well. There's some amazing vineyards all around because we have beautiful country in the Maryland, Virginia area. I work in our Annapolis office, and it only takes me about a half hour to drive out there every day. And then the beaches of everything from Lewis, Delaware, down to Rehoboth and Dewey and Ocean City, Maryland, and Chincoteague and Assateague are all about 2.5 hours away. And honestly, New York City is not a bad drive at all as well. I'd like to briefly bring up the policy created by the Child Neurology Professors of Child Neurology, along with a variety of other national organizations, regarding virtual interviews. Due to the ethical concerns in creating disparities amongst programs, guidelines have been suggested that we do not record any interviews, and we do not provide any food, gift cards, or gifts or swag to applicants, as these really are unfair to you. In the past, you would have been here in person. We would have went out to dinner with all of our fellows and had a really good time. And I really miss those days. But I also really can appreciate that this has created a better system, probably moving forward. One, economically, it is substantially cheaper for you. As a program, this has not impacted us nearly as much as it would as an applicant. It allowed for you to really also take an honest look at the programs and not be manipulated or biased by what we do. If we went out to a great dinner in Washington, D.C., you might really use that in how you unconsciously bias yourself and how you think about our program. But we really want you to think about our program as the training program. I promise you DC is awesome, and I promise you the hospital is too. But there are a lot of awesome hospitals and programs in this country, and I really want you to be honest with yourself about what you need from a program and what we can provide, and make your decision based on that. So my apologies for not sending you a t-shirt or giving you a mug. But we really felt as an institution and as an organization across the country, this is unfair to applicants. In addition to that, the ACGME and NRMP have very specific rules about post-interview communication. So I feel very passionately about this, and I've said this since way before these recommendations came out. But again, I'm in a position of leadership where I can manipulate you, and I don't want to do that. I want you to make an honest decision about this program. So I will send you an email after the interviews saying thank you for coming. It will be to everyone, be CC'd together, and it'll give you the overview and some of the PDFs of what we used here. After that, you are more than welcome to send me legitimate questions, or I can field them out to people in our faculty that you might have actual questions about. I will not, however, tell you anything about how your interview went or where we plan to rank you, and I would ask you to do the same. I am going to make an honest match list with all of our faculty and our fellows at the end of this match season, and it's going to be based on who I think fits best within our program, and I would ask you to do the same. And if we both do that, the match works to both of our advantages, and we all get where we want to go the most, and you get to come to us if that works the best for you as well. So please don't take offense to this, but I would prefer people do not email me unless they have questions. You are welcome to say thank you very much, but again, please don't feel that my lack of telling you where you're going to be on our match list means by any means that you are not going to be ranked or ranked highly. So as we get to the end of this, I think our program is unique in that it's a program of constant improvement. We are a busy program, and we never want to pretend that we're not. On the child neurology ward service, we have between 12 and 20 patients most days. The consult service, you're going to have 5 to 10 most days. The PICU service, you're going to be following 10 to 12 patients. It's busy, but it's not so busy that you're drowning. It's busy enough that you are learning all the time. And we've put in all of these other measures to make that handleable and so that you can still get educated. So there are nurse practitioners involved in those units. We have a variety of pressure valves that kind of pop when things get overwhelming. We have night float now, which allows for you to get out of here on time and get home and see your family and your friends and take time for yourself. But you're going to get exposed to everything here, from the most simple things to the most complex. And I promise you, if you do your child neurology at Children's National, you will be one of the best child neurologists in this country if you take advantage of the opportunities we have. I think our culture is really team-based, and I don't think of fellows as fellows. I think of them as co-attendings or just colleagues. And I think all of our faculty feel that way. And our fellows work with each other and rely on each other to provide the best care, but also help each other out in times of need. Real life happens around us. And there's been a lot of tragedy in the lives of everybody we know, including our fellows in the last few years. And I've not had to get involved any times at all, because they stand up and say, I'm going to help out, and I'm going to cover your shift, I'm going to cover your night float, I'm going to cover your clinic, whatever they need, because they know that they're part of a family, and it's important to all of us to be part of that. I think our night float and outpatient rotations in the last couple of years have really improved our educational opportunities and the work-life balance. Our faculty is really diverse, and they're really dedicated to providing formal mentorship. Our subspecialty clinics and multidisciplinary approach is just really broad, and I think provides you with a lot of opportunities for learning. As I mentioned earlier on, you'll be engaged in every decision. This is not a top-down approach, and when there is a problem on the ground, I depend on the troops to tell me about it and help me figure out solutions that are going to be meaningful to you. And so if you like the kind of place where you can be involved in those decisions, this is the place for you. We definitely focus on wellness, quality improvement, and education. And finally, DC is awesome. It's environmentally conscious, it's diverse, it's cultured. You have easy access to the entire East Coast and the world. And so we would love to see you come here. So in conclusion, we are a top 3 pediatric neurology training program in the country, and we have a really diverse patient population, which allows for you to see everything you need to see to be a successful child neurologist. Our faculty and our trainees are diverse as well, and there's opportunities for clinical, educational, and research excellence while you're here. We have one of the best academic epilepsy programs in the country. I would argue that we have the best neurohospitalists, neurocritical care, neonatal, and now these consult and night float teams also have really rounded us out perfectly. We promise that everybody here is devoted to your education through patient care, quality improvement, and teaching. Promise we will help you pass the boards, and we have no concern that that won't happen on your first try. We really focus on resident wellness and the program leadership between myself and Dr. Strelzik and all the leaders around us. We will advocate for you every step of the way. Finally, it's a really culturally rich city with easy accessibility to the rest of the world. So thank you for listening. I hope you didn't fast scroll through all of this, but it's okay if you did. I'm glad we were able to send the slides and do this video this year. Finally, much like my no need to communicate after this, I think you're all excellent, I'm sure. We'll talk more at your interview, and no need to send any thank you cards or thank you emails. I'm thankful you came to interview with us. You had a lot of choices for that. Finally, we do have a Instagram and Twitter feed at this time. The hospital has its own Facebook and LinkedIn. And thank you very much for joining us.